With Paulina Firozi, it would be great news for the prospect of containing the coronavirus pandemic if only people with symptoms typically spread the virus, as the World Health Organization said yesterday. But the WHO's announcement was immediately met with skepticism and pushback from prominent health and medical experts, underscoring how the scientific community is still far from consensus over how the novel coronavirus operates. The question of whether asymptomatic people were helping drive the virus's spread is critical, and a central argument for social distancing and lockdowns. Because most researchers believe this is a common way the virus circulates, even people at low risk for the disease or who are not showing symptoms were nonetheless warned to behave as though they were already infected. With Paulina Firozi, it would be great news for the prospect of containing the coronavirus pandemic if only people with symptoms typically spread the virus, as the World Health Organization said yesterday. But the WHO's announcement was immediately met with skepticism and pushback from prominent health and medical experts. Democracy dies in darkness. Get 1 year for $29 gift subscriptions. Sign in newsletters and alerts. Gift subscriptions. Contact us. Help Desk. PowerPost. Subscribe. PowerPost. But now the WHO says asymptomatic people are not a main driver of new infections. Maria Van Kerkhove, head of the WHO's Emerging Disease and Zoonosis Unit, didn't entirely dismiss the idea that people without symptoms can spread the virus. But she did say contact tracing research from around the world suggests that it's much rarer than previously thought. We have a number of reports from countries who are doing very detailed contact tracing, Kerkhove said. They're following asymptomatic cases. They're following contacts. And they're not finding secondary transmission onward. It's very rare. Maria Van Kerkhove, head of the WHO's Emerging Disease and Zoonosis Unit. Marshall Turdini/Keystone/AP. Kerkhove pointed to a paper published last week by the WHO, which updated previous guidance on mask wearing based on the latest research about the virus. The report warns that studies on asymptomatic transmission are limited and small, but says available evidence suggests people without symptoms are much less likely to transmit the virus than those who develop symptoms. The report noted several relevant studies. In one, just 9 of 63 infected but asymptomatic individuals in China infected another person. Another study found no secondary transmission among 91 contacts of 9 asymptomatic cases. If you actually go back and say how many of them are truly asymptomatic, we find out that many have really mild disease, very mild disease. They're not COVID symptoms, meaning they may not have developed fever yet, Kerkhove said. But key experts in the United States say the WHO's conclusion presents some big problems. It's not that asymptomatic people don't spread the virus, but the contact tracing is simply bad of detecting it, they argue. The studies cited by WHO relied on only a small number of people in China who claimed to have gotten sick from someone who had symptoms, which is not exactly a rigorous scientific experiment. They also worry that their findings will lead to confusion. There's a difference between people who truly never showed symptoms of coronavirus and people who were pre-symptomatic, who had not yet developed symptoms but eventually would. Then, of course, there are low symptomatic people who are experiencing effects of coronavirus so mild they might not be noticed. Andy Salavat, former head of the Centers for Medicare and Medicaid Services, said that in an email exchange with the WHO, the organization admitted to him it can't distinguish between asymptomatic and pre-symptomatic people. At the end of the video, I present to you some simple methods to prevent the spread of COVID-19 in the workplace. The initiative to take some precautions may be important even if the injury does not appear in your workplace. Some simple measures may help prevent infection from spreading in the workplace, reduce absence days due to illness, and slow the spread of infection. Ensuring hygiene and cleanliness of workplaces. Desktops, phones, and keyboards must be constantly clean and sterile because contamination of surfaces that staff and customers touch is one of the main ways it spreads. COVID-19. Promote and encourage regular hand washing by employees and clients. Place hand sanitizers in prominent places in the workplace. Ensure that sterilizer dispensers are regularly refilled. Ensure that soap and wash basins are available to wash hands frequently, as washing kills the virus on the hands and prevents the spread of COVID-19. Display posters inside the workplace that illustrate the correct way to wash hands. Strengthening respiratory protective measures. Ensure the availability of muzzles for those who have symptoms of a runny nose and head to the nearest healthy facility to make sure and do the necessary. Displaying stickers inside the workplace on sneezing etiquette that helps reduce the prevalence, COVID-19, in the event of travel. Advise employees before embarking on this travel necessity assessment. Avoid sending employees on business trips who may be at greater risk of developing a serious disease, such as older employees and those with medical conditions such as diabetes and heart and lung disease, to areas where it is common. COVID-19. In the event of an urgent need to send employees on business trips, they must be educated and sensitized to the precautionary measures about corona infection. COVID-19. Staff safety measures. The employee needs to stay at home or work from home if he has a mild cough or low-grade fever, 37.3 degrees Celsius or more. The employee needs to stay home or work from home if he uses certain medicines like paracetamol/acetaminophen, ibuprofen or aspirin, which may mask symptoms of infection. Continue to provide awareness through the communication channels used in the workplace in cases that need to stay at home or work from home if they have only mild symptoms of COVID-19. Preparations of the working environment in the event of arrival, COVID-19. Collaborate with public health departments to identify and follow up with those in contact with confirmed and suspected cases.